Good afternoon, everybody, and welcome to today's Facebook Live virtual lunch meeting. Thank you so much for joining us. My name is Sam Tchaikovsky, and I'm the Sales and Marketing Manager for the JCN. I'm just going to run through a couple of bits of housekeeping before we get underway with the session. So today's event is titled Transparent Wound Dressings, demonstrating the value of Mepitel One. And today we have two speakers for you. We have Liz Hamlet and we have Janine Bowshall. And they are both clinical support managers at Mölnlycke. Hi, guys.
Hi. Hi, good afternoon.
So today's session, as you can imagine, is sponsored by Mölnlycke. So a big thank you to them for supporting the event. We really do appreciate it. Certificates are available at the end of the session. So your CPD certificate can be downloaded in a link that we'll post in the comments section. So keep an eye out for that. Do bear with us if there are any technical issues. I'm sure there won't be, but if there are, our team will be in the comments section, keeping you up to date with everything there. You might recognise that we're all recording this remotely as always, so do bear with us if there are any issues. Finally, please do leave any questions in the comments section. So Liz and Janine will be back at the end with me to have a live Q&A. So if you have any questions for them, please leave them in the comments section. We'll get through as many of those as possible. That's all from me. I will now pass you over to the speakers. So Liz and Janine, I'll hand over to you. Good luck and thank you very much. I'll see you at the end.
Thanks very much, Sam, and welcome everybody to this afternoon's session. So our session objectives for today are to understand the impact of using an adhesive out in clinical practice. We're going to revisit SafeTac technology and in particular take a look at Mepitel One. We're going to have a look at the role of clinical evidence and what this means for us in practice. We're then going to have a look at a correct dressing application, and we're going to end towards the end of the session, we're going to discuss the importance of undisturbed wound healing.
Thank you, Janine. So for some patients living with a wound, routine dressing change can be a stressful event and also an inconvenience. It can also be costly for patients if they need to take time off work or pay for travel to attend regular appointments. Not forgetting that pain at dressing change can also increase stress, and this can result in impaired healing. In a recent survey of patients living with a wound, 90% reported that their wound impacted their quality of life. 26% said they saw friends and family less often. 48% could not walk or exercise for long periods of time. And 30% complained that they had to have their dressings changed daily. On some occasions, the dressing we apply can result in damage. This damage can occur when the cellular layers of the skin are unable to withstand the strength of the adhesive on some dressings when we remove it. This in turn can cause skin stripping, blistering and skin tears.
Yeah, and what Liz has just described is demonstrated in the image that you can see on the screen. So on removal of some traditional adhesives, separation of the epidermal layers can occur. And in severe cases, the epidermis can detach from the dermis completely. Skincare education is paramount to promote effective wound management. And when we link it with product education, better outcomes can be achieved for both our patients and for staff. Clinicians can adopt confidence in the dressing capabilities and their use, and better patient outcomes can result in less stress and less pain during these dressing changes.
Thanks, Janine. So how can we prevent skin damage for our patients living with a wound? For those of you who are familiar with dressings that Mölnlycke produce, you will perhaps have heard of SafeTac, the soft silicone technology which facilitates atraumatic dressing changes. SafeTac's journey all began with Thomas Farbo in the mid-1980s. Thomas was a young product developer who worked in the research and development department in Mölnlycke's wound care division.
He certainly did, and since then, innovation has continued to ensure our SafeTac technology delivers above and beyond the ordinary. Our advanced wound care portfolio is proven to help optimise the wound healing journey and can also support in the prevention of wounds. Dressings with SafeTac are the safe choice for patients, and they're a champion for higher standards in wound care, and they continue to be trusted by clinicians just like yourselves to treat hundreds of millions of patients around the world today. SafeTac has been used by clinicians for over 30 years in a diverse range of clinical areas. We have over 450 pieces of peer-reviewed evidence to support its use in practice, and incorporated into that bank of evidence, we have over 30 randomised control trials. As you can see from the image on the screen, the cellular layers of the skin remain intact on removal of a SafeTac dressing.
So now we have provided an overview of our technology, we wanted to discuss one product in particular, our wound contact layer, Mepitel One. The SafeTac technology is across the whole surface area of the Mepitel One dressing. It gently adheres to the cellular structure of the skin, sealing the wound edges. This is beneficial when exudates are present, as the fluid is unable to move horizontally under the dressing, it can only move vertically. It is then wicked away to a secondary dressing, minimising risk of maceration to the wound edges. One study highlighted the cost of maceration alone was £175 per episode, which I'm sure you'll agree is a significant amount of money and one that could be avoided, therefore highlighting the need for prevention.
It certainly is a significant amount of money, and as we know, reducing maceration is the key component to support in achieving healing. Failure to address maceration can result in wound size deterioration. This can lead to longer healing times and therefore result in increased dressing changes and, of course, increased nursing time. While Liz has identified the benefits of the adhesion of SafeTac, it's also important to recognise that the dressing will not adhere to moist tissue. Therefore, the wound itself stays protected and the new healing tissue present is not disturbed or damaged on the dressing change.
And in addition to what we've already detailed, there are many other benefits to using Mepitel One for the management of wounds. For instance, it's really gentle. It's suitable for fragile, vulnerable and aged skin, reducing pain and skin damage for patients. Mepitel One minimises patient discomfort at dressing removal, and it seals the wound margins on application, therefore reducing possible risk of maceration.
It's also durable, and its durability supports undisturbed wound healing. It leaves no residue on the wound bed and this dressing won't dry out. It can also remain in place for up to 14 days, and this longer wear time can support in minimising the risk of introducing infection. There is evidence to demonstrate that Mepitel One can support in achieving improved healing rates, can reduce nursing time, and is a cost-effective approach to wound management.
The transparent polyurethane net enables optimal wound assessment by providing complete visibility of the wound bed so a wound assessment can be completed without having to remove the dressing. The perforated structure allows drainage of exudates from the wound bed into a secondary dressing, and topical creams can be applied on top. A secondary dressing can then be changed without disturbing the Mepitel One.
You'll note on the slide the image in the circle. This image is printed on the back of the smaller sizes of the dressing itself, and it's helpful when used to facilitate management of skin tears. This image can support in the safe removal of the dressing, ensuring that there's no disruption to the healing skin flap. So here on this slide, you can see just how transparent Mepitel One is when compared to other wound contact layers. Again, this allows for easy wound inspection without having to remove the dressing. So with this dressing in place, a full wound assessment can still be completed. The measurements can also be taken, which is a huge benefit and promotes completion of the correct documentation which is required for wound dressings.
And this transparency is a really great example of how we can support patient self-care, because the primary dressing is able to stay in place and it gives the patient confidence to manage the outer dressing changes themselves.
So, as well as being suitable for the management of skin tears, Mepitel One is designed for a wide range of wounds, most of which you can see on the slide, and quite often, I'm sure, which you will manage yourselves in your daily practice. You may well now be thinking of certain patients that have wounds like these, where you can possibly start to utilise Mepitel One in the future. One instance that I can recall in practice is a patient who couldn't tolerate compression. Therefore, where you needed to rethink things when managing his venous leg ulcer. This patient chose to have Mepitel One as his primary dressing. This facilitated the protection of vulnerable skin, and it also supported an atraumatic dressing change. A superabsorbent dressing was then applied on top to facilitate exudate management.
I think this is a really good example, Janine, because we know that the gold standard for the management of venous leg ulcer is compression. However, in reality, we also have patients, for whatever reason, either can't follow an advised treatment plan or just can't tolerate compression. And in those circumstances, we have to work with the patient to achieve a suitable outcome. So in addition to the wounds that you see on the slide, Mepitel One can also be used on surgical incisions, blisters, lacerations, and radiotherapy-induced skin damage. And an added benefit of Mepitel One is that it can be also used as a protective layer on non-exuding wounds and areas of fragile skin.
And it doesn't end there, because Mepitel One is also indicated for use with negative pressure systems. So the dressing is placed directly on the wound bed underneath the foam filler, and it's placed there to protect the new and fragile tissue as healing progresses with the therapy. So at the start of the presentation, we mentioned clinical evidence and clinical evidence in practice. So why is evidence important? Evidence-based practice within your clinical area can be delivered in the form of implementing best practice guidelines. So, for example, implementing the recommendations of ISTAP regarding prevention and management of skin tears. ISTAP is the International Skin Tear Advisory Panel, a multidisciplinary approach to improve patient outcomes for skin tear prediction, assessment, prevention and management. And their best practice guidance is what you can see here on the slide, and it's available to support you in all your clinical areas.
Thanks, Janine. So ISTAP developed a classification system for skin tears, and using a system in practice ensures a common language for identifying and documenting skin tears. You can see on the slide the recommendations for dressing requirements, and all these recommendations are achievable in the application of Mepitel One for skin tear management. The flexibility of the dressing allows it to mould to the contours of the skin without pulling it, which can be experienced with traditional adhesive dressings. This can result in shear and friction injuries, which may cause blister formation. The extended wear time of 14 days can optimise patients' quality of life and can reduce the frequency of dressing changes.
Thanks, Liz. And here on the slide, you can see the classification system that Liz was referring to. So the images provide a visual appearance which demonstrate the skin tear classification system, which was developed by ISTAP. One key advantage of using Mepitel One for the management of skin tears is the supporting detail, which I alluded to previously on the back of the dressing. The arrow detailed within the dressing can be aligned to the position of the remaining skin flap of the wound.
That's a really valid point there, as it facilitates dressing removal to ensure it's removed in the direction of the tear, which in turn avoids any disruption to the healing process for the skin flap itself.
So what we're going to do now is just play you a short video demonstrating the application and removal of Mepitel One. And we've already mentioned clinical evidence so far in the form of sort of clinical guidance. And you may recall that we highlighted the amount of evidence that we hold for our SafeTac technology. And here at Mölnlycke, evidence to support our products in practice is something that we're very proud of. And despite our expansive history, producing evidence is something that we continue to do for our products in practice today, and Mepitel One is no exception. We know that in the evidence hierarchy, randomised controlled trials sit high within the pyramid, and for some are recognised as gold standard, and Mepitel One supports this level of publication.
Yeah, thanks, Janine, and that's really good to know, because as healthcare professionals, we have a responsibility to act on the basis of best available evidence within our clinical roles. We all have a responsibility to assess need, deliver, or advise on treatment. And in order to do this safely and effectively, we need to ensure our practice is up to date. With this in mind, and to support you in practice and to increase product knowledge, you have access to our team of clinical support managers like Janine and myself to assist with updating your knowledge on our range of products, providing up-to-date evidence to support its use in practice, as well as developing best practice pathways for appropriate dressing use.
Thanks, Liz. And I think highlighting the access our clinicians have to the clinical support team here at Mölnlycke demonstrates how it can assist in development of knowledge and skills can then be implemented into the assessment process to be sure that you're choosing the right product at the right time for that particular patient, depending on your assessment findings, which in turn helps you to deliver safe and effective care, which, as we know, is a fundamental requirement of our professional code.
Thanks, Janine. We're now going to play a short video to demonstrate how inappropriate layering of dressings can be used in practice. For many, a wound contact layer may be the primary dressing, but quite often this can be followed by multiple layers of different dressings.
I agree, and here we can see Mepitel One being used, followed by an application of a gelling fibre. And as you can see, unfortunately, the appropriate size isn't available. Therefore, 2 dressings are being used to manage this wound.
Yes, and on top of this, we have gauze followed by an absorbent pad and multiple layers for fixation.
Yes, something I can relate to in practice. And often in practice, this layering of dressings is used to promote management of exudates, or perhaps because the clinician doesn't have confidence that a reduced amount of dressings can actually manage exudate quite efficiently.
Yes, and unfortunately, excessive layering of dressings can hinder clinical outcomes, can have a negative impact on nursing time, increasing waste and dressing cost.
I agree. And given the recent findings by Guest et al. Regarding the cost of wound care totaling 8.3 billion, I'm sure that you'll agree we all have a responsibility to promote cost efficiencies in our clinical practice.
I mean, £8.3 billion, that's just an incredible amount of money.
It absolutely is. And when we consider how that has increased from the 2014 paper, where the findings were 5.3 billion, it's definitely a continued concern for wound care for the future. So I think it is important to take a moment to reflect on areas of practice and to consider if you too have witnessed layering of dressings during wound care delivery. And perhaps you yourself can identify any areas for change, because even the smallest change can have a huge impact, and it can support in delivering these cost efficiencies.
Thank you, Janine, and I agree. Small changes can significantly impact practice. One area we can achieve this is to understand the benefits of undisturbed wound healing in practice. Undisturbed wounds are those left to physiological closure of the body's typical acute wound response, leading to healing without complication. Unnecessary dressing changes can prolong the healing process, and implementing the basic principles of wound bed preparation and moist wound healing can in turn maximise the wound healing process without complication. A recent survey of patients living with a wound found that 30% complained that their dressing needs to be changed daily, highlighting what was referenced earlier, that for some patients a dressing change can result in inconvenience when trying to manage a work-life balance.
So here's another short video which may just help you to implement a change regarding undisturbed wound healing and reducing the use of excessive dressing layers in practice.
Yes, I think sometimes we can overcomplicate the situation. I know I certainly have done in the past. And Mepitel One is a really simple dressing which is easy to apply. And as you've seen by the variety of wounds it can be used on, it's really versatile. Here it is being used to dress a laceration by simply applying Mepitel One with an absorbent pad and securing it with Tubifast.
And I think the video demonstrates, and I think what you've said, Liz, is a great example that future changes of the secondary dressings can be completed without removing the Mepitel One. And in doing that, we promote that undisturbed wound healing alongside reducing costs.
So I'd just like to continue on the theme of undisturbed wound healing so we can understand the importance of this in practice. Aspects such as quality of life and psychosocial factors are of paramount importance. In a recent survey, 90% of patients felt their wound impacts their quality of life. And as I mentioned earlier, 26% saw their friends and family less as a result of their wound, which is really sad, really. One particular aspect that can affect quality of life in particular is pain. Pain during dressing change can cause fear and anxiety for our patients. And as clinicians, I think we've probably all seen the stress and upset some people feel whilst the dressing is being changed, or the anticipatory pain at the very thought of it being changed. So there are lots of reasons why undisturbed wound healing is important.
And that's something that I can definitely relate to in practice. And of course, we want our patients to lead as normal a life as possible. So less dressing changes can perhaps help them to improve their quality of life, but it can also promote their involvement in their own care. One study by McGuinness et al. Concluded that every time a dressing is removed, the wound is cleansed with room temperature normal saline, the wound bed itself can drop by, on average, about 2.7 degrees. This can actually result in the wound itself taking 3 to 4 hours to resume normal cellular activity to then promote that healing. Therefore, for this period of time, we can see a delay in the healing process. And in addition, the more that we change a dressing, the more likely we are to introduce infection as we open it up to an environment for pathogens and bacteria to enter.
Thanks, Janine. It has been suggested that the ideal dressing should reduce the amount of times the wounds are exposed by ensuring the appropriate number of dressing changes is based on clinical need and not habitual practice. So selecting an appropriate dressing that supports undisturbed wound healing, promotes an optimal wound environment and is atraumatic can benefit clinical practice. Reducing dressing change frequency has also shown to save valuable nursing resources, promote healing, offer improved financial outcomes as well as clinical outcomes.
Thanks, Liz. And I was talking to a friend of mine who actually works in healthcare recently, and her particular patient, or one of her particular patients, was travelling twice a week to the practice for his dressing changes. And unfortunately, due to COVID, he's lost his job, and this has resulted in him having to make choices between spending money on travel and to get to the practice on those twice weekly appointments to receive his treatment, and worrying about the increased cost of heating on what is now very little income. And I'm sure the reality of his story, it's not an isolated incident.
That's true, and what an awful story that this gentleman faced, and decisions he has to make, like you said, whether it's heating or having his dressing changed. And like you said, I'm sure it won't be an isolated case. So what was the outcome?
Well, he sat down with his nurse, discussed his concerns with where he the situation he now finds himself in financially. And from this conversation, a treatment plan was then devised where he could reduce his practice visits. This entailed implementing Mepitel One. It also entailed educating him on completing specific areas of his own wound care management. And in doing so, he's now completing the secondary dressing changes himself between his practice appointments. So he's now only seeing the practice nurse every 2 weeks for his dressing change at the practice.
What a fantastic outcome for this gentleman. We're empowering him to manage his own wound and reducing his visits to the practice, saving valuable nursing time as well. So for this gentleman, this highlights the importance of self-care documents like the one you can see on this slide. And these tools are available, freely available to support you in practice. So just to summarise on our session today, we've probably all seen through our careers as healthcare professionals how dressing technology has evolved and how important it is for clinicians to be aware that everything we do in practice needs to be evidence-based. We've also touched on the importance of undisturbed wound healing. The longer the dressing is left in place, it creates the optimum wound environment for healing and is more cost effective. by making small changes can make a huge difference. And maybe just give some thought as to how important a transparent wound contact layer is it to you, and how it can benefit your practice.
Thank you, Liz. And just looks kind of on the final few slides now, really. And so I just wanted to bring your attention to the slide that you can see on the screen, which is Mepitel Advantage, which is our educational hub. You'll see that there's a web address there. Feel free to take a picture of that or make a note of it. Within this, within the web address that you see there, you really do have a wealth of information at your fingertips. We've got information wound etiology and therapy areas. There's many webinars and podcasts on different areas and different specific topics. There's also e-learning modules in there. So if any of you are going through the revalidation process, then these can help support you in regards evidence in your revalidation for practice. There's clinical evidence and insights on there as well. And you can utilize the Case Finder app. You can see a QR code there on the screen in front of you. Feel free to scan that live now from your screen, and that will give you access to the clinical evidence that you can then take into practice. You know, if you've got any queries and you want to look something up in practice, then you can utilize that Case Finder app to then support and guide you in any decisions that you make. There's also products and solutions. At Mepitel, we have a wealth of products within our portfolio. We also have many solutions where we can support you. If you're experiencing any of those challenges in practice, then please do feel free to reach out to us. We've also got, as we ended the session on, as you can see, the patient shared care materials, again available at your fingertips, and we hope that you can start to utilize this in practice. We know they have become more common as we've all been living through the COVID pandemic, about empowering our patients and encouraging them to get involved in their care, and those patient diaries really are a very useful tool. So we do hope that you find something on there that can support you in practice.
Thanks, Janine. Yes, please feel free to access Mepitel Advantage site to discover what's freely available to each and every one of you. So in addition, our clinical support team are all healthcare professionals who maintain registration status, and we are happy to provide educational lunch and learning sessions either virtually or face-to-face. So if you are interested, follow the link here and one of us will be in touch to arrange. We really hope you've enjoyed our session today, and I now think we're going to a question and answer session.
Brilliant, guys. Thank you so much for that presentation. That was really interesting to hear. And I do urge everyone to have a look at some of those resources. I know our team will be posting lots of links in the comments section. So have a look after the Q&A session. But all the links and everything, all the information will be available on the slide deck, which will be loaded onto our website in the next 24 hours or so as well. Excuse me. So we're now going to move on to the live Q&A. So I've seen a lot of questions coming through, so we'll move straight on to that. Question one is it suitable for heavily exuding wounds to prevent peri-wound maceration?
Yes, it absolutely is. Heavily exuding wounds are ideal, really. So with the safe tack technology, the Mepitel One will tack to the dry areas, and then by using an absorbent pad or a secondary dressing, the exudates will transfer through the small holes into the secondary dressing, wicking it away from the wound, and into the secondary dressing, and that will protect your peri-wound to, again, avoid maceration, which we've just heard can cost £175 per episode. So it's a real significant amount of money.
Brilliant, thank you. So on to question two. What advantage is there to using Mepitel One under compression?
I'll go again.
Do you want to take that, Liz?
Yeah, thank you. So again, with the Mepitel One, very safe to use under compression therapy. Again, with the safe tack technology, it tacks to the peri-wound, to the dry skin, so it can protect that excoriated flesh from the exudates. It will then transfer all the exudates into the secondary pad or the compression. It also, because it's got the safe tack, it won't roll down. It will remain in place. And yes, you can leave it there for 14 days, but obviously compression therapy, gold standard would be 7 days. So yeah, really safe to use under compression therapy.
Fantastic, thank you. Question 3, is it suitable for sensitive skin or patients with latex and adhesive sensitivity?
Do you want me to take that one, Liz? Yes, it's suitable for patients with sensitive skin. It's very, very gentle, and as you saw on some of the images, you won't get that traumatic removal with regards the cellular removal that you can see on some particular adhesive dressings. So it is suitable for sensitive skin, it's suitable for aged skin and that vulnerable, fragile skin. So yeah, you can use it with confidence.
Brilliant, thank you. Question 4, what are the advantages of Mepitel One over traditional Mepitel?
Do you want me to take that, Liz? Or yeah, nodding. So Mepitel One kind of demonstrates really how Mepitel has evolved. Mepitel One, as we've mentioned throughout this session, is more transparent. So you've got that true transparency. However, they do both work in the same way. They've both got the benefits of safe tack. Mepitel does get the safe tack adhesive on to both sides, if you like, whereas the Mepitel One only has the safe tack on the one side. The bonus of having the Mepitel on both of the safe tack on both sides of the Mepitel dressing is that, as we know as clinicians, sometimes 2 hands are not enough and we need the 3rd hand. So especially if you're managing lower limbs, for example, and you've got a wound contact layer on, you know, when you're trying to get your bandage in and everything else on there, sometimes what that secondary dressing that you apply on that lower limb has a tendency to, with gravity, either roll down or fall off. So the fact that you've got your safe tack technology on both sides of your Mepitel One, you've applied your Mepitel One onto your wound, which is anchored nicely down onto the dry peri-wound skin, and then your secondary dressing, so your absorbent pad, you can apply on top of your Mepitel, and that's basically that 3rd hand. So that will keep nicely that dressing in place, which frees you up to then get your wool, your crepe, whatever your bandaging is that you're utilising for that wound.
Brilliant, thank you. So I think should we alternate who answers the questions? We'll go for Liz for this one. Question number 5. Can the dressing be used within cavity wounds at all? And would the dressing mould to the cavity wound bed as well?
You wouldn't use it to pack a cavity wound. You would use a gelling fibre for more than 2 centimetres deep, but certainly it could be used on top of the wound. And then I've forgotten the question.
I think just to jump in there, if you were managing the cavity wound with negative pressure, then you absolutely, you know, it depends, as Liz said, if you've got a cavity wound and you're wanting to manage the exudates, then you would directly put the gelling fibre into the cavity wound, as Liz mentioned. But if it was a cavity wound which was being managed with negative pressure, you could line that cavity wound with your Mepitel One. And again, it's about protecting that fragile, that vulnerable, newly healing tissue that's being generated by that therapy.
Mm-hmm.
Brilliant, thank you. So question 6, you say topical creams can be used over the top. Could you apply a daily steroid cream for the 14 days without removal?
Do you want me to take that, Liz?
Yes.
Yeah, you can irrigate through. So as Liz mentions, the dressing itself has perforations. So you can irrigate through when you want to clean the wound. As long as you can see that the holes within the dressing have come clear, then, you know, as you irrigate, then you can pat dry and reapply your topical ointments. So it might be whatever topical ointment you're applying, but you want to make sure you've got good irrigation there and that you don't have any residue sitting. So as long as you've got clear irrigated wound that you can then see, you've got the visibility through those perforations, then you can reapply that topical ointment.
Brilliant, thanks very much. Question 7, can it be cut to a smaller size or will it affect its performance?
No, it absolutely can be cut to size. I mean, it does come in a variety of sizes, but yes, it wouldn't affect the makeup of the dressing if you needed to cut it to size.
Brilliant. Question 8, how long can we leave Mepitel One in the wound bed?
Well, Mepitel One has a wear time of 14 days, as we said. Now, obviously, nobody wants to leave a wound unattended for 14 days, but you can leave the Mepitel One dressing in place, change your secondary dressings. As we've mentioned, if it's a wound that did need irrigation, you can do that while Mepitel One is still in place. You don't need to disturb Mepitel One to irrigate that wound. You can then reapply your secondary dressings and just make sure that you pat dry around that peri-wound area as well.
Fantastic, thank you. Question 9, you mentioned that Mepitel One can be used over a skin graft. What benefit does that provide?
There's a lot of benefits for applying Mepitel One over a skin graft. The main benefit, or one of the benefits, is that Mepitel One won't dry out. So there are other contact layers that you might be familiar with where you can see it drying out after a couple of days. Mepitel One will maintain its integrity as fresh as the day that you get it out of the packet. It won't dry out. With regards to fixation of the graft, it can anchor the graft down beautifully. All we need to do is make sure that the peri-wound skin is dry, because if you remember what we said in the session, the Mepitel and the SafeTat technology won't adhere to anything moist. So as long as we've got a nice dry peri-wound, we can place the Mepitel One down on top of that new graft, and it can anchor down onto that nice dry peri-wound. You've also got the transparency benefit of Mepitel One, which means that if you wanted to check the graft, as you could check it as often as you needed to without the graft being disturbed. So you're getting a true sort of promotion that graft is then going to take onto that new tissue. And as I say, you've got the transparency of that to change as and when to get that visibility that you need to.
Brilliant, thank you very much. So question 10, I think this is the last question we've got for you today. Thank you everyone for submitting your questions. Oh, one more's just popped through, so we've got 2 more.
Sorry, Sam, can I just interrupt you? Because
yes,
we do, for anybody, I know we've mentioned evidence in the session as well, and for anybody that did ask that question with regards to skin grafts, I know that we do have evidence specifically on skin grafts. So if anybody wants to access that, then send us a message after the event and we can point you in the direction of the evidence that supports its use with regards to skin graft management.
Yeah, absolutely. So question 10, we'll go on to that, and then we've got one more final question, number 11. So question 10, can it be used on diabetic foot ulcers and leg ulcers?
Yeah, absolutely. It can be used on a really wide variety of wounds, including DFUs and leg ulcers as well. And it's really versatile. It's really pliable. So, it can go in any wound. And then again, you just pop that secondary dressing on, whether it be a pad or under bandages.
Brilliant, thank you. So on to the final question. As I was saying, thank you very much for all your questions. They've been great, and the answers have been fantastic as well. If we haven't got through to your question, we will answer those in the next few days, and we'll post those on our website along with the slides. So on to the final question. I use a foam dressing currently for skin tears, as I can put an arrow on the dressing so it's removed in the right direction. How can I do this with Mepitel One?
Foams are being used a lot in practice for skin tears, especially if the foams have the added benefit of SafeTat technology. However, there are instances when you might not want a foam dressing in use, and if that's the case, then we would promote the Mepitel One. And then, when you consider the secondary dressings that you can use with regards the management of the skin tear, you might not. So the secondary dressings that you saw in the videos, for example, that was a Tubifast, or you might have a cling bandage, you wouldn't need the arrow on those particular dressings. And the added benefit of using Mepitel One with a skin tear is that when you remove the secondary dressings, the image on the back of the dressing itself will direct you in the direction of removal. So you're still getting that safe practice, even though you can't, even though you've not got the arrow there. Like you said, that's why you're using a foam. You've got that already in the image imprinted on Mepitel One itself. So you've still got that added benefit of utilising the safe removal with regards to the direction from the image that you get on the back of Mepitel One.
Perfect. Thank you very much. Liz, Janine, thank you so much for that session and for answering all those questions. We really appreciate your time, and I'm sure everyone who's been watching has thoroughly enjoyed the session. Thank you, Malt and Liquor, as well, for supporting the session. We really appreciate that as well. And to everyone who's watched, thank you for spending your afternoon with us and for submitting all those questions. So the recording and the slides will be available on our website in the next 24 hours. Your certificate link will also be available in the comments and on the screen in the next moment. So download that, make sure you get that for your CPD. To arrange to speak to Malt and Liquor, the clinical support team there, you can visit that website that was mentioned on the slides earlier. It's maltandliquor.co.uk/campaigns/Mepitel UK. And that should also be in the comment section as well if you do miss that. Make sure you follow our page for it so you don't miss any future events. We'll see you for the next one. Thank you so much for your time, and we'll see you again. Cheers.